Heather Lewerenz. I'm a psychiatrist in private practice in Midtown Manhattan, and I'm a member of Kygo Health. I decided to become a psychiatrist in medical school. I was always attracted to the behavioral sciences, and I really like working with people who are struggling with emotional and psychiatric problems, as well as substance abuse. I've been a psychiatrist since 2002, and I've had my private practice since 2007. We see a wide range of patients in our practice. I work with 2 psychiatric nurse practitioners, and through the nurse practitioners we're able to offer much lower rates for patients to get their psychiatric care. So basically our patients might come from any walk of life, of any age, any demographic, and basically what they're looking for is to improve their life through improved mental health. And we really try to meet the needs of as many people as we can in our practice. Manhattan Psychiatric Services, which is our practice, is really a very unique structure. Like most psychiatrists in Manhattan, we do not take insurance. We're not on any insurance panels, but a lot of New Yorkers are stuck. They're paying a lot of money for health insurance, and they can't find a psychiatrist who takes that insurance. So what we do is we work with very qualified, very experienced, intelligent psychiatric nurse practitioners so that we're able to offer much reduced rates for our psychiatric care. So you're still in a very supportive, very comprehensive concierge-style environment, but you're able to get your psychiatric care at much more affordable rates. Well, I would say that it's very important to take a look at all aspects of your life. Clearly, perhaps there's a physical issue or medical issue that needs to be addressed, and we would help screen for those things, talk about those things. There may be lifestyle issues that need to be addressed. Some of the behavioral strategies to get better sleep, for example, can be really helpful. Some dietary interventions, exercise interventions. And then if we do need to talk about medication, we would go over with you the risks, the benefits, what kind of options and choices you have to help you make an informed decision about how to improve the quality of your life. And then we monitor you to make sure that you're tolerating medication well, that you really are improving. And basically by taking kind of a holistic approach like that, we're able to really help improve the quality of your life. My name is Heather Lewerenz again. I'm a doctor and a psychiatrist. I'm from Salina, Kansas, where I was born and raised, and I went to the University of Kansas for medical school. I think that was a really good experience. They were really training us to be very well-rounded physicians, and then my husband and I decided that New York was the place that we wanted to be. I came to New York and I worked in a psychiatric emergency room for 7 years, which really gave me a very unique perspective on the city and what people go through to try to survive in the city. And then, then opened my private practice, and my husband and I live in Queens, New York with our 2 kids, and so we've really been very happy to build a life in New York and be an integral part of this community. My husband is an artist, he's a filmmaker and a writer, and so I try to stay very much involved in that community and pursue those activities as well. And I try to practice what I preach in terms of lifestyle. I think that if I get out of balance, then I can't take good care of my patients if I'm not taking good care of myself. So I think that sleep and exercise are really important. In fact, one of my sort of pet projects right now is I'm working with a colleague on a book about workaholism, because I think in New York it's really easy to get over committed to work and be spending too much of our time and energy on that, and so life gets out of balance. So that's a little bit about myself, and I hope that was helpful.